still be able to identify the DNA. So it was quite fun, and we were able to do it and thoroughly and enjoy the science part of it. Okay, so today I will try not to be too sciencey, but hopefully a little bit for everyone. So the science geeks will like a little bit, have some take home. The average person who cannot handle too much science can have a take home, and that's where I'm positioning this talk to be. Okay, so yeah, okay. Disclaimer: no claims of healing, treating, curing, or diagnosing being presented. And the views expressed in this talk are just my own opinion for educational purposes. Okay, so I don't represent the government or any hospital or even any organization that are specifically trying to sell things. Okay, so it's just my view. Okay, so talk coverage. I'll put stem cells, what it cannot do in some perspective. I won't spend too long on it, but more to look at how, if you are convinced by what stem cells can do, then how do we execute it in medical science, okay, in scientific world and in general wellness world. So you have different ways of putting more stem cells in. Okay, assuming you accept that stem cells are pretty useful. Okay, and then how to decide what works, comparing stem cell delivery modalities, especially with respect to regenerative therapies. And then last of all, my favorite part is actually, I want to show you the latest in stem cell research. And the latest in stem cell research actually have to do with guidance targeting system. How do you guide and target stem cells? So if I put stem cells in, how do you target to the location that your body needs, especially, let's say, to arrest a disease or arrest a progression of cancer and so on. Okay, and then we'll conclude. And at the end of this, we'll have a time of question and answer. So as I talk, feel free to develop your questions. You can even write your questions on the chat group in case you forget, right? Take note so that we can have a meaningful discussion at the end of this talk. Okay, without further ado, let me introduce regenerative medicine. Now, when we talk about stem cells, we are talking in respect of what we call regenerative medicine. Regenerative medicine simply means or is concerned with creating, developing technologies or therapies that regenerate or replace injured, disease, or defective cells. For example, in the pancreas, if your beta cells do not work, then your pancreas cannot balance the insulin, okay, cannot manage insulin, and then you might develop diabetes. Okay, so stuff like that. So whether it's a cell, a tissue, or organ, we are interested in trying to restore some of these. And why do we do this? For the purpose of restoring some form of function. Okay, so if you're paralyzed, you can't move, or you're a Parkinson's patient, you shake too much, you can't hold a cup without spilling. If we can manage that a little bit, then that is a form of regeneration. Okay, so regenerative medicine is important aspect to our talk. Now, the other thing that's interesting is when we talk about regenerative medicine, doctors have to work with scientists. So last time it was purely doctor doing the treatment. It still is, but now they have to, for example, take certain cells and then give to the scientists. The scientists develop the cells, plate it, grow it, and then after give back to the doctor. The doctor executes the management of the patient. Okay, so you see doctors and scientists working hand in glove in order to improve this regenerative medicine. Okay, so so now how do I go next slide? Okay, So let's start with something simple. What do stem cells really do? They do a couple of things. One, most importantly, they differentiate or can turn into many types of cells that the body needs. So there are 220 different types of cells like muscle cell, bone cell, fat cells, cartilage, even skin, right? Skin got different layers. So for example, when we talk of the heart is not just heart cells, but heart is made up of muscles, nerve cells, and fat, and so on and so forth, that constitute the organ called the heart. So that's one. All right, it's a base cell that can turn into anything that the body needs, any cell that the body needs. The second thing it does is it reduces inflammation. And the third thing, it can regenerate. So in other words, if I have some stem cells, some will regenerate to more stem cells, some will go and douse inflammation, and then some, and most of them will go and turn into the different cells that your body need to replenish. Okay. Now, the last thing is stem cells can help fight apoptosis. Apoptosis simply means that our cells are programmed to die itself, especially when it detects a virus attack or cancer. So in other words, in a healthy state, if our immune is strong and we are healthy, right? And if I get cancer in some way, or I get COVID in some way, my healthy cell will know how to, hey, this is not normal. It will self-die. Okay, so stem cells allow these cells to actually proliferate further. So you have even longer cell life. Okay, so you still die, I mean, apoptosis, but if they are not infected, the stem cell will help this fight cell death, okay, or prevent apoptosis. Okay, so I just want to give one example like the heart. Why I chose the heart? Okay, so the question is, how can stem cells repair heart muscle? Why I chose the heart is the heart has a very limited ability to regenerate. That's why when people get a heart attack, right, and we take too long to go and resuscitate them, what happens is, even if we do successfully resuscitate them, they live, but heart muscle die, right? Because the blood was not able to reach there, so no oxygen reached the heart muscle. So part of that heart muscle actually dies. And when it dies, it generally is very hard to recover, almost impossible. So the goal in cardiovascular medicine is to induce healing using the capabilities of the human being. What I mean by that is this. If remember when we were young and you got a cut on your hand, right? You got a cut on your hand, actually quite quickly, the body will repair itself. We didn't have to do anything. It's all natural. So the body has different, will know how to amass certain cytokines, certain chemokines to go and fight all these infection. And then after that, send signals to repair, restore. So after a while, the cut disappears, right? But in the heart muscle in the heart muscle, basically, it doesn't do that very, very well. Okay, so this is where, for example, this is looking at this heart. There's a plane across, and you can see the picture of a damaged left ventricle that was received from a heart attack. Okay, and then how stem cells can regenerate that to a normal functioning left ventricle. Okay, so how it does this is this. Stem cells are actually taken, in this case, from bone marrow from the patient's own hip. Okay, so this is a surgeon doing it. Then what he does is, of course, they process it, and then stem cells are re-injected into the heart's damaged area. So in this case, right at the apex of the heart, the tip, the bottom tip, the muscles die and they can't regenerate on its own. So they use fresh stem cells to inject there, causing the environment to re-establish itself. So how does it do that? The cells from the bone marrow, the mesenchymal stem cells, they embed in the area of the heart, and they produce proteins that signal growth and regeneration of new blood vessels and new heart muscles. if it regenerates sufficiently, you find the heart can function on its own once more. Okay, so this is one way to use the undifferentiated cells to become heart cells and then trigger signaling and restoring heart function. So there are a lot of stem cell research. People study relating to retinal diseases. People study, and a lot, and when I say signaling, actually it's from mRNA. Okay, so all of us now are experts in mRNA, right? Because of thanks to the COVID vaccine. So we understand how mRNA works, right? If mRNA, so you have your DNA blueprint, and then your mRNA is a signal to go and do things. A signal for cells, for the protein to know what to go and do the normal function. Okay, so when it comes to stem cells, there are three main, I summarize it as three main important considerations. Number one is stem cell numbers. So here we are talking about the quantity. So if someone sells you something and they claim there's a lot of stem cells in this cream, actually what you want to know is what are the numbers? Okay, how many stem cells? Okay, and I'll tell you what are the numbers to look for. Then the second thing is stem cell quality. So this quality means could be the source, could be how we process it, how we harvest the cells. From where did we get it? Did we get it from a plant, from an animal, from a young human being like a baby, or an old person like 80-year-old? So where did this source come from? And then last of all, can the stem cell reach its intended target? Okay, so this will be a question relating to the mode of delivery and what I call guidance targeting system. Okay, so that's the last part. Hopefully a little bit exciting, and we all will learn something today. So I'm going to talk of stem cell numbers and stem cell quality together. Okay. So when it comes to stem cell numbers and quality, medically, what we try to do is we generate a few ways, right? So one is we can take it from the patient's own person. We call that autologous. So where do you find most bone marrow? The answer is in your hip. So in your hip, there's this thing called the iliac bone, where what they'll do is a special needle, a very big, strong one, puncture that. It's very painful. And then after that, we extract the stem cells. Then using the laboratory, we process it to get rid of all the junk, leaving the stem cells. So usually this procedure grants us about a few hundred to maybe at most 1,000 stem cells, of which we will then re-inject it into the person. For example, let's say he has knee pain because of a cartilage worn out, maybe re-inject here. Okay, in the case I mentioned, they re-injected into the heart using a catheter to deliver the stem cell to that location. Other ways could be like you can actually put in the brain. Okay, so I'll talk a little bit about the brain. I'll tell you where they put the stem cells, and then you can, I think should be quite interesting. Okay, so this is a place we get stem cells from. The second place that was a new discovery not too long ago was there are a lot of stem cells in fat. Okay, so what happens is, next all the fat people now become very happy, right? Wow, I can sell stem cells. Dr. Daniel, please take stem cells. $100 per, probably will cost me 1,000. Okay, so you can take stem cells from fat, and so fat was shown adipose cells to have a lot of adult stem cells. So you can take these stem cells, again, go and combine it with growth factors, for example, hyaluronic acid, like we always talk about this in beauty, and then maybe even time release, and re-inject it back into the face. Okay, so these are two areas, one bone marrow, and then one from fat. Then there are other places that came out in reports. So I like reading, and guess what? So, one of the studies actually said that there's a lot of stem cells in menstrual blood. Wow. I was at a medical conference, so I was talking to medical doctors. Straight away, you have some 40-year-old medical, those, uh, doctors, right? So these ladies came up to me, a few of them, that, hey, we donate our menstrual blood to you. At that time, I'm not so socially adaptable, so I didn't know how to respond. I just smiled. Uh, don't know what to say. Okay, but in other words, it's fascinating where menstrual blood, fat, things that sometimes we don't want, we want to throw away, actually were found to have stem cells. So question is, can they then harvest that and deploy that for certain diseases? Then maybe cheaper and so on. Okay, so these are some of the interesting ways we look at it medically. Now, I want to so I talked about how we deal with it medically, just very briefly, and now how we can deal with it from a general wellness perspective. Okay, so the first one I'll talk about is this non-invasive acupoint photostimulation. Okay, and that is just now some people were in the chat group was talking about X39. So that's a product that was created by a friend of mine. I consider him very, very, very smart. His name is David Schmidt. Okay, if you meet him in person, he's a very humble, very nice man, but very, very smart. Okay, don't try to outsmart him. He's smart. Okay, but the nice part is when we're together, we like to discuss things. We like to, look at new ways to do things. So he invented this product which he called X39 or experiment number 39, and then they trademarked it. That helps. All you have to do is stick it onto the skin, and it helps to boost a peptide called GHK copper. Now, GHK copper relates to, if you check it, if you Google it, GHK copper actually relates to activation of stem cells. And then what stem cells do is they can support wound healing. It can help you recover from things, right? More cells to go and repair, more cells to go and regenerate, right? So if you have enough, then maybe some of the diseases can be regenerated. Okay. Of course, there are limitations, like all things, meaning that where the stem cells, if you ask what is the source of the stem cells or the quantity, well, it's endogenous. So endogenous simply means that no choice, right? It comes from your own body. So if you're an 80-year-old person, then all you have is 80-year-old stem cells. Okay, so not a lot. Okay, so if I remember correctly, the body is approximately 30-something thousand trillion cells. I think about, say, 40 trillion cells or 100 trillion cells. So depending on what number you choose, but in the trillion. Then what happens is when we were babies, we actually have something like approximately 4 billion stem cells to support your 40 trillion cells in the body, right? Differentiated into 220 different types of cells. So in this case, then as a teenager, the number drops. So as we age, the number and quality of stem cells drop. So as a teenager, say 18 years old, it drops to maybe about 400 million stem cells to support the 40 trillion. So the cells don't change, number of cells don't change, the stem cells change. So but for 400 million cells, remember as a teenager, we all recover in no time, right? So we're all happy. Then I don't know whether you remember, when we hit 30 years old, suddenly it felt like we aged, right? So what happens is, because the stem cells drops from 400 million to something, calculate about 150 million stem cells. Okay, so 400 to 150 is less than half. What happens is suddenly we feel old, or we take longer to restore. So if we fracture our arm at 30 years old, somehow it didn't take 1-2 months to recover. It took 6 months, maybe even longer. And then at 50, it drops even further to less than 100 million. and then by 60 to 80, it can drop to even just 20 million stem cells. So from a teenager of 400 million stem cells, you drop to about 20 million stem cells by the time we age. What does that mean? It implies that if you are 60, 70, 80-year-old and you fracture your hip, there's a good chance you won't recover at all. Okay, so just bear this in mind. Keep safe. Walk a bit more carefully because you don't want to get injured. Now, neither do we want to do too many surgeries. I'm not against surgeries, but if you do let's say if you do an open chest surgery, the surgeon has to go and cut all your ribs, right? So it's like a fracture, like a bone fracture. So when that opens, when he closes you back up, the stem cells have to go there to repair it. Now, your ribs are big bones. So you find that if you're 50 years old, it's very, very hard to actually recover naturally. So that's why forever we'll have this weakness in the bone structure. Okay, so basically we only do surgery selectively when there is an absolute need. Okay, so sometimes we learn to assess how old are we and do we do a surgery, right? For me, what I'll do is, let's say if it's my parent who needs a surgery, I'll ask the doctor what are they going to do, so that I can understand and I can assess for myself and for my parents whether do we want to choose surgery. Yeah, no point paying a lot of money and it still don't work, right? Okay, so back to the X39. What it does is it's a little sticker like this lady, right? Dr. Karen Khan, she pastes on her and it works. How does it work? It's non-invasive. So how does it work? Simply by your body heat, activating the patch, getting reprogrammed to a healthy signal, and then stimulating the cells. So we usually put it on preferred points, like maybe an acupuncture point. Why? Because acupuncture points usually connect to a meridian. So you paste there, but it affects the entire being. Okay, so, but don't worry, if you don't know where to paste, just anyhow paste on the body. Generally, it still works. Okay, so, right, it doesn't cause harm. So what it does is it then stimulates the cells to think that it is young again. So if the cell thinks it's young and it needs to regenerate into younger and younger or more corrected DNA, then maybe as we patch, as the days go by, our cells become younger and younger. That's why some of you, right, you are pasting for different things, and then you realize actually one of the things that happen is somehow the skin looks younger and younger. So this is a outward expression of reverse aging of tissue. So imagine if this reverse aging that you can see on the outside is happening on the inside, like maybe, I don't know, your heart arteries, right? From a stiff artery, if it becomes more pliable, then that's pretty cool. So I just want to show you, there are a lot of papers also written on this, on how frequency and electromagnetic fields can support bone marrow stem cell cell differentiation. Okay, so basically at certain wavelengths, our body likes it and what they call self-heal better. I give you an example. We always say the sun is good for vitamin D, right? Giving us vitamin D. But the sun doesn't really inject vitamin D. When we are outside in the sun rays, what happens is the sun ray touch the skin and our body biochemically makes the vitamin D. So we have more vitamin D. So in the same manner, Richard, sorry, I mute you because we got some noise coming from your side. So what happens is the sun actually, so vitamin D is created because sunlight has landed on your skin. So your body is wired to produce certain peptides that go and are responsible for doing things, right? So using the patch, like the stickers, people have used it to support like wounds that cannot close, right? Because of poor vascularization. So in other words, this is a diabetic neuropathy scenario where the wounds generally don't close because the blood supply to that area is poor. So so if you can trigger, energize the cells, energize the reverse age the arteries, then maybe you have a chance to uh, actually start to close the wound, at least anecdotally. Okay, anecdotally means these are not clinical trials, but from experience. People try it, and some say it works, and they're very happy. Right, so a wound that cannot close finally closes within, I think, 2 months, 3 months. That is good because open wounds are sites of infection. This is another nice picture of someone who had his fingers severed. And again, even if you sew it on, because there's no vascularization, no blood supply to the tips of his finger, you get necrosis, right? The finger become black, basically dies because no oxygen in, no blood supply. And you find how you, just by patching, again, you can, if you can boost stem cells in the body, and the stem cells are able to go to this finger site to restore some vascularization, then in this case, his finger was restored, and within about 2 months or so. Okay, so this guy was lucky. Instead of losing the finger, he managed to save it. Then the last photo is one on scarring. So again, this is a open thoracic surgery. So they open the chest area and the stomach area, and there's usually leaves behind an ugly scar. And then after this one took about a year of patching, and again the cells, the traumatized or scarred cells remodulate to healthy cells, and as they get the signals to become younger and younger and younger and younger, 1 year later it looked kind of normal. Okay, which means now they can behave like normal cells. Okay, we were talking about stem cell numbers and quality and how it's important. So now I'm going to talk about injections. When it comes to numbers, there's nothing that beats injections. Why? Because just like medicine or even chemotherapy, right? Chemotherapy now there's a pill form, and well, not injection, but they kind of drip the chemo into you. This will be the fastest way, biggest way to actually push in lots and lots of numbers. So, of course, in general wellness terms, you hear people talking about lamb placenta and deer placenta, and these are the two favorites that seem to work very, very well. Okay, why they don't use like elephant placenta, or I want lion-hearted? Why they don't use lion, I don't know. But lamb and deer seem to be the most accepted, most tested. I'm talking about tested over 60, 70 years now. So it's not a new technology. It was actually discovered, I think, in the 60s. So maybe about 60 years or so. Okay. Okay, a comment about stem cell injections is, so I was looking at the two, and I decided, okay, the lamb looks cute, the deer also look cute, they're both cute animals. So I started to investigate, and I realized lamb, in the world, there are billions of lamb, whereas the deer, there are less than 1 million deer in the whole world. Did you know that? Actually, I didn't know that. So they are now classified on endangered species list. In other words, if we keep taking deer stuff, including deer meat, it may go extinct, So my preference for that reason is lamb. I don't know which is better, but I play a lot with lamb, and for that reason, because I don't want to disturb any endangered species. Right, it's a bit like those poachers, right? They go and kill elephants for their tusks. I think if you carry a tusk back to Singapore, elephant tusk, you probably get stopped at the immigrations. Okay, so That's why sometimes for elephant tusks, they tell you, right, the best is don't buy. If you buy it, then you're encouraging the elephant, those poachers to kill elephants just for their tusks. Okay, so in other words, as the world changes, right, like with COVID, we want to look at other ways of obtaining stem cells. That's why the research goes into where else can we find stem cells from. And one of the latest is we could find it from fat. I think there's even someone who, I remember reading a paper, you can even find it from dentine. In other words, if your teeth decay, you can actually push stem cells, signal stem cells to regenerate the teeth. In theory, right? Okay. So lastly, general wellness, you hear a lot about oral pills, right? Pills and creams. So I'll just talk a little bit about this. So the pills are like that, right? Which means inside the pill, they'll put the stem cells inside. Okay, I just want to comment that in light of this recent report, so there was a recent report that one of the stem cell company, the pill company, they started claiming that, wow, can cure cancer, can cure diseases. So Health Science Authority in Singapore actually warned them, and then they keep going, wow, can cure this, can cure that. So finally, they were convicted and fined. They could have ended up in 2 years jail with a fine of up to $5,000 or something like that. Anyway, they were convicted. Now, I want to use this because, sorry, so even if you are selling this product, I don't know much about this product, but even if you are selling it, just bear with me. Just take a open picture. People have to understand how pills work. So if I put stem cells in the body, in a pill form, and I ingest it through my mouth, what's going to happen is it will go into the stomach, and then, right, it will dissolve, and then it will, the enzymes will attack it, and then it goes into the bloodstream and goes into the small intestines, absorbs into the bloodstream, and then the stem cell have to go to the desired location, like your heart, and then actually trigger your heart to regenerate. Now, when the pathway is through the stomach, what's going to happen is the enzymes, the what we call low acidity, the 0.5 pH, is going to just wipe out the stem cells. It's going to eat out the stem cells. Okay, because the stem cells are not very stable. So so basically, I had a discussion with one of the guy from this place, and I think he got insulted by what I said. Said, I'm not trying to attack you, but he said, but anyway, it still really cures cancer. I said, they just fine you for saying you cure cancer, and then he still say, he still insists it cures cancer. So I had to try to logic with him that when it goes through the stomach, the chance of it getting absorbed in the bloodstream and delivered to the specific organ is negligible, or very, very low. And when we're talking, you need 400, 200 million stem cells, 100 million stem cells to even do something. You can't even get enough of the stem cells in a pill. So I asked him, guess, because I formulate this for different companies, multinational companies, how many stem cells do you think is in a pill? He don't know. Okay, so you can ask that question to all your cells. How many? They don't know. Let me guess. Anywhere between 50 and at most 1,000 stem cells. From the cost, I don't even think it's 1,000. Okay, so if I cost it, that means being in business, you have to have a certain ratio. If I cost it at most 100, 200 stem cells, so you have to take many pills for a long time to have some effect, to have maybe right? And we just said 20 million stem cells can't even regenerate anything. That's why an 80-year-old, you got more and more wrinkles, because we can't even maintain you, let alone go and cure diseases. So when you look at numbers and quality, it's very important that to manage the way we sell our products, so that it becomes we become more responsible. Okay, so don't just claim that, well, can cure this, can cure that, can cure. Okay, you can say it supports the human being, the healthy cells, to go and do something to maybe restore, support cancer in some way, but not to cure cancer. Okay, this is very important because sometimes even when I teach in our health coaching course, and particularly when they are a group of MLMers, after my 2-day session with them, people will still say, but can cure. Okay, so don't use this word because you really can go to jail for using that kind of terminology. So it's not worth it. Okay. Okay, so don't feel bad. Right, Straits Time presenter observed that sellers made claim that this pill can treat diseases. Another keyword, cannot treat. Only doctors can treat. Okay, so at most you can advise lah. So think of the pill as like a supplement, a vitamin supplement, maybe with some deer placenta, and don't know how much, but so it's at best a supplement. Okay, in other words, better than nothing, but would I pay that much for it and then take from a deer? For me personally, I won't, right? Okay. Yeah, so they kind of argued all these aspects of whether a pill works. So they concluded that it's actually wrongful advertising, misleading advertising. That means aim to mislead people. Okay, which brings me to stem cell drinks and creams. I think some of you know I stay in Toa Payoh, right? So Toa Payoh Central, there's this bubble tea shop. So one day I walked by and the lady, wow, hey, my bubble tea got stem cells and collagen. And I said, wow, okay, how much? $2.80. So for $2.80, I could get a bubble tea with stem cells and I said, okay, give me a glass, right? I mean a cup. Of course, there's no stem cells, right? So even if there is, at most it's plant stem cells. And even if you really put deer placenta in this drink, again, it's going to go into my stomach. My enzymes are going to destroy it. So, or maybe a smarter way is they hide it in the bubble tea, the jelly, right? So the stomach will eat that away, and perhaps by the time it passes through the stomach, the stem cells remain. Okay. So at $2.80, no way, but it's a good marketing gimmick. Okay, I say a good marketing gimmick because the stem cell, even if there's stem cells in there, they don't go and they will not be able to cure anything, let alone do anything that stem cells do. Now, when it comes to creams, I must say it can work. Okay, so this is not my brand. I'm not selling this, but creams, stem cells in creams can work. How do they work? Basically, because you have preservatives, and what is happening is it's able to send a signal. That means you are put on the skin. There are no enzymes there to go destroy the cream, so it's there for a while, for a short while, and during that short while, it can, using the mRNA signaling or at least some form of signaling, to signal my own cells to maybe try to restore better. So of course, like all things, I must put a lot and put for a very, very long time. Okay, but anything orally, tough cell. Okay, very, very tough cell. So understand this so that so even if people say you feel good, I think you feel good when you take it, that's good. It's a good supplement. Take it as a supplement. Okay, not for curing purposes. Now, finally, where I want to come to, the third important consideration is how do you do guidance targeting of stem cells to a particular area. Okay, so you want to, like just now we talked about the heart, we want to target that specific point, the apex of the heart and its heart muscle. How do we actually shoot the rocket to go there? So in real life, you have seen, right, guidance targeting system. We've seen it in the military, where we can put a missile through a window very accurately. We have also seen it a lot in medical. So during my time, we worked. This is in the 90s. We worked a lot with virtual reality and something called AR, augmented reality, right? So the future at that time was that doctors will use this VR, and then from there a lot of extra information so that they can see around the tissue and while they are doing their surgery, right? More information may allow them to execute the surgery a bit more accurately. Okay, so there are guidance targeting systems. So back to the question, how then do we put stem cells in the body and target specific sites? Okay, so and this actually is the holy grail of stem cells in regenerative medicine. Okay, why is this important? Because like all your weapons and all that, it's limited supply of weapons, limited supply of stem cells in the body. So we want that limited stem cells to go to where it's supposed to restore, right? So if there's a knee cartilage problem, we want it to go there, and maybe not go to my face and make my face young, right? Maybe the primary concern is not my face but my knee. So how do I allocate it to that? How do I target that area? Now, medically, of course, we can actually inject it onto that site. This is basically between the knees. It's a very, very painful process, right? But you can inject it there. But we realize after that, the scientists realize when you inject there, if there is a certain signal from somewhere else, let's say the upper thigh or your face, the stem cells can actually start to move somewhere else. So you stand to lose some of the stem cells. Okay, so one, of course, is to just inject on site. And remember, there are always areas we can't get to. Let's say in the brain core and all that, I can't like open up your brain and then go in and find a spot, then inject there, right? I'll start to destroy other facets. So one way is medically, that's how they do it. Then this came about. This is an interesting paper. Just last year, December, was announced, but the paper was published in November 2020. In fact, on the 20th as well. So 20 November 2020, it was published. And what this paper showed is that these scientists were able to identify that they use the body's mechanism to actually allocate the stem cells, target the stem cells in a particular location. So what they realize is how the body works is to attract stem cells to an injured site. The body naturally releases something called chemokines. Okay, these chemokines cause recruit, send signal to recruit stem cell to his location, right? Like a soldier calling for artillery fire on your position. Okay, so however, the chemokines also cause inflammation. And when inflammation is prolonged, right, we have a cytokine storm. So that's why it will cause, in this case, it was related to the brain, so it will cause other brain and body related harm. So chemokines were good in that they help recruit stem cells to that location, but natural chemokines, according to them, also cause inflammation. Right? So this guy, Dr. Evan Seidner from Sanford Medical Discovery Institute. So he did a very interesting experiment. I'll just summarize it for you. So he put stem cells in the brain ventricles. These are the brain ventricles, basically in the center of the brain. Okay, this blue thing that you see here. Okay, then what he did was they actually okay, so from the top view you see the brain ventricles here. So he put stem cells there, and then what happened was, let's say they want to target the back of the head, then they put something called SBD1A there. Okay, SBD1A is this new molecule that somehow attracts. So the stem cells move from the ventricle to the side of the brain and then to try to restore that. So they found that humanly we could create targeting molecules so that or proteins or peptides, so that the stem cell can like magnet go towards that location. Another study in using rats, what happened was they put the stem cells on the left side, they injected on the left brain, and then on the right side, they put this SDV1A, and what happened is the stem cell actually moved to the other location. And this occurs naturally. That's why sometimes when we put stem cells in me, let's say, right, and they put the same stem cells in you, you may have, your stem cells may go and repair your knee, whereas my stem cell will go and repair my face. Why? Because of this so-called SDV1A. In other words, there is the chemokine, they call it CXCL, ligand receptor. Ligand, for example, is like this. So let's say this, my hand is a ligand, okay? So it's a like with a little round thing, and this is my receptor. So there's a chemokine ligand, which is CXCL12, right? L12 ligand number 12 is found in the chromosome number 10. Okay, so they isolated it. They found that this chemokine has to do with recruitment of stem cells. So if you can identify the receptor, so I can make a receptor so that my thing can receive, like lock and key, very specific. Okay, so if I can identify a receptor, I can make the ligand, attach it to that molecule, and then when it attaches, I actually transfer. So this is what we call targeting system, very much like our vaccine case. Okay, I explained before when I talk about COVID ligand receptor targeting, so that I don't go and destroy other things. Okay, so using that, the chemokines, so they took the chemokine 12, they don't want the chemokine 4, and then that basically helps to take the good without the bad, simply put. In other words, they have the part that can recruit stem cells, but don't want the part that causes inflammation. Okay, so they created a new peptide. Now, interestingly, so this is only just last year, right? Clinical trials still being done. But interestingly, in general wellness mediation, actually, there's something called organo stem cell rejuvenation holiday. I'm actually part of it. So, why I like it is this, and why I continue with it. With it is simply this. What this does is it uses the lamp. It takes out specific tissue, right? Up to 80 different tissue and cells, tissue, organ tissue from a lamp. And one lamp can support many, many, many human beings. Then what happens is we process it in a lab, right? Clean it up, make sure the junk is all gone and it's sterile. Then while the cells are alive, we inject it back into this area. So when injected, the cells like eye cells will go to your eyes. Okay, heart cells will go to your heart. Heart muscle will go to heart muscle. Heart nerve will go to heart nerve. So now we are able to actually extract from the lamp all the very specific. Okay, someone not happy, right? So they're going to draw on this thing. Let me share. And Irene, can you stop drawing, please? Okay, so let me reshare this. Okay, so what happens is it then moves to all the specific location like brain, eye, even gum, anything that we think relates to an aging person. So now you have natural targeting systems. Okay, natural targeting systems, so not human synthetically made, but natural systems that go to that location and deploy the mRNA signal to that location so that the organ, the tissue, the cells regenerate and regenerate correctly. Okay, so this is what happens. So basically it goes to all the, so what these organo stem cells do, and what I like about it is it's a very tedious process for the scientists, but when you regenerate all the different organ and organ tissue at the same time, then we are able to see, again, anecdotally, that even some of the critical cases like Parkinson's, multiple sclerosis, which is nerve damage in the brain, or even forms of blindness, cartilage problem, pains here, pains there, hormone balancing, heart restoration, all this rejuvenates. Okay, and it will do that over a 6-month period, depending on your own cells, how fast they regenerate. Okay, so after that 6 months, you are like near as good as you can be, and then you have probably another year and a half before you start to deteriorate again. Okay, so you kind of stop time, in fact, reverse time. Okay, so I'll kind of end here with some final remarks. I want to talk about stem cells, because just now that one talks about cancer, right, the pills. So stem cells do not cure cancer. Okay, I repeat, stem cells do not cure cancer. What stem cells do is stem cells send a signal to rejuvenate, to make healthy cells more healthy, and cancer cells that actually become cancerous and progress because of a DNA mutation, they can signal the cancer cells to hopefully mutate back to more normalcy. And when they are more normal, you find that the cancer cannot grow so fast. Okay, but unlike chemotherapy, so chemotherapy, you put it in, it kills the cancer. So they term it as it cures cancer. Of course, the bad part is they also kill healthy cells, right? But my whole point is it's a legal terminology. So don't get offended if I say the stem cell pill cannot cure cancer. It is true, it cannot cure cancer, but it's because of technicality. Okay, so sometimes we learn from it. We are humble enough, we learn from it, we can do things better. Yeah, then you can sell your pills with more balanced statements. Okay? So just to summarize, stem cells have been proven time and again in regenerative medicine. There is more and more certainty that one day stem cells will be a key form of what you call future medicine. That means surgeons who are now used to cutting surgery, right? They cut tissue. Eventually, they must deal with stem cells, because that's the only way to deal with some of these degenerative diseases like cartilage wear and tear, like hormone imbalances, like eyesight problems, right? Blindness, like brain nerve damage, spinal nerve damage. So to regenerate, they must look at stem cells. Actually, it's kind of the only way. Nutrition and all that, supplements, they can only provide material so that they don't decay so fast, but they cannot reverse a disease state, or harder to reverse a disease state. Okay, the second thing is stem cells, as we talked about, numbers, quality are important, and then now targeting technologies are vital considerations. Okay, no point I go for an expensive stem cell treatment, inject, and then it goes everywhere else except the place I want it to manage. Then the third thing we talked about is medical intervention. We take it from marrow, from fat, but when we are looking at it autologously, that means from your own body, then if you're an 80-year-old man, then at best what you have is 80-year-old stem cells. So not very high quality, and your numbers are low. So even if I increase 20 million by 50% to 30 million, they still don't do much. Okay, that's why pills and all that, they don't work from a stem cell perspective. Right? From a general nutrition, vitamin, that's fine. But from a stem cell perspective, pill taking it through orally is actually a bad choice. Even if I claim I have technology and I create pills for people, right? You put plastic around the stem cell to prevent it. You have to eat a lot of plastic just to get a little bit of stem cells that in the end still do nothing. Because we are talking 200 million, or else it cannot reverse disease. Okay, so things like cancer, they are serious disease state, especially 4th stage cancer. where it has metastasized to the whole body, I tell you, the pill form is not going to do much. Okay, nor a lot of other injections. So general wellness strategies come into play in that you can patch, like just use a sticker, like we talked about X39. You can do organo stem cell rejuvenation, and if you still want pills, you can take it as a supplement. Yeah, if you're very wealthy, you're rich, you don't mind spending money, then it's okay too. Okay, so with that, I've come to the end of my talk, but I want to end on a light note. I used to like Indiana Jones. Okay, it's a action adventure, and it starred Harold Ford, is it? So I remember this one time where at the last part of this Indiana Jones movie was he had to choose which is the cup of life. And this wise man, this old soldier, right? He said, you choose wisely, you have the life. You choose foolishly, you'll die. So of course the bad guy chose foolishly because he chose a nice golden cup. And then he drank from it, and then it turned to be the wrong cup, not the cup of life. And then Harold, Indiana Jones, I forgot his name, Doctor something in the movie. In the end, the cup of life was a wooden cup. Okay, not very nice looking, very ordinary wooden cup. He chose it because he rationalized that that will be the real cup of life, right? Because in those days, all they had was wood. So he drank from it, and then he survived. I don't know, gunshot wound or something. Can't remember the story. Go watch it. But so I hope you, with this knowledge, you can choose a bit more wisely. And again, if you want to discuss with me, you're always happy to meet me separately. Okay. So with that, I thank you. I'm going to open this time for question and answer. Before that, if you have any interest, please contact the person who invited you. You want to try the X39, see what it does when it boosts stem cells. You can just ask them. Okay, or you can even contact us. Yeah, I think the best is to WhatsApp